This is a video talking about the paper, Abulia, a Delphi survey of British neurologists and psychiatrists. A brief overview of Abulia is that it's a relatively uncommon yet debilitating lack of spontaneous and goal-directed behavior, and it's seen predominantly when the patient has lesions on the basal ganglia or in the frontal lobes. It's one of the three disorders of diminished motivations and falls in the middle of the spectrum between apathy, the less severe diminished motivation disorder, and actinic mutism, which is more severe. The reason for this study was that while Abulia has been known to clinicians since 1838, it has had many different interpretations, and some of them have been contradicted previous ones. Due to a resurgence in behavioral consequences of basal ganglia diseases, there has been a necessity for clarification of terms and concepts in this still poorly understood area of diminished motivation disorders. The survey had two parts. In the first phase, they interviewed 6 experts on disorders of diminished motivation. They had semi-structured interviews with them and asked such questions as, complete the sentence, Abulia is a lack of blank, where they had to choose some terms such as will, motivation, or drive. They also consisted of several true or false questions concerning Abulia, as well as questions concerning possible treatments for Abulia and what is best, and diseases that are also related to Abulia and what is perceived to be possible causes for those. The results from this first phase were that 5 out of 6 considered disorders of diminished motivation a distinct clinical category consisting of a lack of passion and drive. Apathy and Abulia were used interchangeably by these experts, and they disagreed on the severity of the symptoms that were required to justify the use of either term. Most of the experts considered Abulia both a sign and a symptom. It was also considered that dopamine agnostics and amphetamines were considered the most helpful treatment for DDM. In the second phase of the video, they sent out a survey to 30 neurologists and 35 psychiatrists, consisting of similar questions that they asked the experts, but in more of a yes, no, or don't know fashion. Only 54% of the surveys were returned, and only 39% of them were completed because a lot of the neurologists and psychologists considered themselves not familiar enough with the field of disorders of diminished motivation to comment. The results of the questionnaire show that 45% of the psychologists and neurologists chose motivation to fill in the blank, while 36% chose drive, 24% chose will, and 20% chose initiative, as in describing what Abulia is a lack of. Most respondents agreed that Abulia was clinically distinct from depression, but only 32% believed that it was different from apathy. Most agreed that Abulia was clearly associated with frontal lesions. Here's a further breakdown of the answers that the questionnaire resulted in, including whether or not Abulia is clinically distinct from apathy, depression, actinic mutism, or whether it's a sign, a symptom, or a syndrome, where the lesions are in the brain, in the basal ganglia, the frontal lobes, or the thalamus, whether it's a prognosis in depression, schizophrenia, Huntington's disease, and what is possible treatments. These are all the true, false, or don't know answers. As a result of this study, Abulia was referred to be a lack of motivation, drive, or will. They were not able to reach a consensus on whether Abulia and apathy were distinct phenomena, but they were able to define certain characteristics that were strictly to Abulia, such as difficulty in initiating purposeful movements, reduced spontaneous speech, passivity, reduced emotional responsiveness, reduced social interaction, and a reduced interest in usual pastimes. The study also showed that guilt, self-blame, impulsiveness, OCD behavior, and delusional thoughts were atypical in a patient with Abulia, and they could be used as exclusive criteria to rule out Abulia in other patients with depression or other disorders of diminished motivation. While apathy and abulia could not be classified as separate phenomenon, it is really essential that they should be defined more precisely so that we can separate one from the other, so that we can avoid confusion with all the disorders that are attributed to a lack of will and motivation.